According to the Nigeria Center for Disease Control, NCDC, between January and June of this year, an outbreak of cholera has killed 325 people in 15 states and the capital. The NCDC also says that over 14,343 suspected cases of cholera were reported from 15 states and the FCT during the period, with 325 deaths. The report further reveals that about 27% of suspected cases across the country are those in the 5 to 14 years of age bracket. Cholera is a highly virulent disease characterized in its most severe form by a sudden onset of acute watery diarrhea that can lead to death by severe dehydration. The outbreak is frequently reported in Nigeria due to the lack of potable water, especially in densely populated areas. Joining us from our Abuja studios for more is a public health expert, Dr. Abiodun Paul. You're welcome to News Across Nigeria.
Thank you for having me back on the station.
It's good to have you back. Now, cholera is, if you'll permit me to say, a very ancient disease on which we shall have a handle by this time. But, however, 15 states have recorded deaths in the recent outbreak. What could have been done to prevent these deaths, and what do you perceive or what do you suggest are the immediate solutions to reduce cases?
Yeah, thank you so much for that question. Let me first commend NCDC for their efforts. Of course, over 300 people have died across 15 states, and the recent one is Yobe, where we have 3 deaths and 2 people are still hospitalized. It is good for us to know that cholera outbreak, just like you said, the history, had been, traced back to John Snowden in a lot of decades of years. But we need to also understand that this is a disease that have a time. Like when you look at the cholera, for example, it starts from May, to somewhere around September and October, and that actually given us an ample of time to really get prepared, to really work on our emergency preparedness plan to see that things are put in place in terms of forecasting what areas is going to be affected, looking at the commodity that's going to be used, what kind of things we need to put together for active case search and case management and our surveillance system. As it is now, I'm sure the management of cholera is not new to the NCDC. It's not new to us in the country, but there's a need for us to prevent, to work effectively before now. And what we can do in the meantime, now that has happened, we need to really create an awareness, just like Channel TV is doing right now, and of course, others media should also be creating this awareness in the language that the community can actually be aware. There is a need to work on the IPC, the infection prevention and control plans, and for health care workers, there's a need for more trainings right away. We need to also make commodity drugs available. We need to also sanitize people on waters and sanitation and hygiene across all the communities affected, so that we don't this disease is not actually continue to spread. So immediately what we need to do is to ensure that there is a lot of things put in place, just as I said, to ensure that all the work activity is online. We increase our active case search, our surveillance is in line, laboratory diagnosis is in line, and of course we can actually manage this. But we really have a lot of time in the country, which we can actually address some of the issues that we have now currently. Thank you.
How do we strengthen our health care systems and provide the link between the rural medical centers with the urban areas as far as the chain of supply for medicine and consultation is concerned?
Yeah, we need to, when you look at the healthcare system in the country, looking at it vis-a-vis the health system strengthening, you look at the leadership and governance. There's a need for us to really work on the area of leadership and governance. Our leader needs to take ownership. We need to start, stop depending on donors. A lot of our services, I can say maybe over 60% are still really donor-driven. Kudos to what the government have done in the past, but I think we should be moving beyond having to depend on donor to strengthen our health system. So there's a need to work on leadership and governance aspect of our work. And of course, you look at the health financing, there should be accountability. What has been given in terms of allocation, in terms of money that has been allocated for health system, how are this money being spent? We need to really ask all these questions. So that actually be addressing the issue of health financing. So we need to really look at how can we finance our health. We need to bring in the private, which is the private-public partnership in line now. And we need to also look at our laboratory diagnosis. We need to strengthen our laboratory very, very effectively to see that a qualified, certified medical laboratory scientists and other laboratory people actually coming together to see that the diagnoses are working. And we need to also see that medicine are available, just like you mentioned. Our supply chain management need to really know what kind of forecasting and quantify the number of drugs that we use available at when due for all the patients as they come to the hospital. So all these are very, very important. Time will not really permit us to mention others, but all these are very, very important. We need to, working with, as I said, the community need to be also participate. We need to begin to look at looking beyond managing our hospitals, beyond the hospital facility. The village need to be involved. The community have to be involved. The patient himself has to be involved, just like we have in East Africa when I was working there, where we have what we call the village health committee. So it has to be something that has to come from bottom to top approach, whereby everybody is involved to strengthen our health system. We can no longer be depending on everything on government, of course, absolutely, but we need to also see that we take care of our health by bringing all the stakeholders that are very important together. Thank you.
Indeed, Dr. Abiodun. Finally, one of the most unfortunate instances is the most recent one, which you are reporting, of the death of 3 people in Yobe State as a result of this disease, which is because it's very preventable. Now, once contracted, and we know that dehydration is one of the outcomes that leads to death, can you tell us how that can be managed so it doesn't have to lead to that extreme consequence?
Yeah, as I've said, 3 out of 5 people, 2 hospitalized. That shows a case fatality rate of over 50%. That is too high. Internationally, globally, it's not accepted. We cannot accept that kind of figure. Only 5 people and 3 people are died already. So, and of course, we know that most of the death lead to dehydration. And if it's dehydration, of course, we have to also make sure that oral dehydration solutions are available at facility. That those need to also be available at all the healthcare or all the treatment centers where these are available in time, because most of these deaths, you get to the hospital, the commodities, the drugs are not, the medicine are not really there. So these are the issues that we need to also work very well. And another thing that we can also do is a simple way of washing our hands, keeping our hygiene very, keeping our environment, hygienic, very clean. So we need to also look at that very, very importantly, that we need to really work on the water sanitation and hygiene. Most of our waters these days, you see animals, human beings also take it from the same water. So this awareness really need to go to really solve a lot of problems. And people need to be aware of case definitions. They need to know what are the signs of these diseases. We need to know, because when people get that awareness, they know that, okay, this is what is happening. And of course, when you begin to have this kind of, symptoms, you report to the nearby treatment center. possibly that have been designated. So all these things are very important in managing patient. And of course, when you look at the stages of patient coming to the hospital from when it's arrival to the triage, and from the triage, the patient is being assessed with a lot of things. The analysis is done, the clinical findings is there to see that it's actually, and of course you look at all the different ways of managing the cholera patient in terms of giving them the ORS and of course other drugs that are very, very essential for them.
Yes.
To see that
they also
rehydration therapy. Their clotting,
Dr. Paul?
So all those are very, very important. Thank you.
Yes. That's taken. We thank you for your contribution concerning this, and we thank you for coming on News Across Nigeria. Dr. Abiodun Paul,
thank you for having me.
Public health expert.